Let's have a little chit chat about nipple shields. Nipple shields are a tool that's commonly used in the lactation world for breastfeeding a baby. They can be used for a preemie baby to help increase stimulation of like, hey, there's something in your mouth, you need to suck on this. It might be used if there's a flat or inverted nipple, or if somebody received a lot of fluids during labor and delivery and the nipple looks flat or inverted because there's extra fluid in the breast from birth. It can be used to help heal a nipple if there was a lot of shallow latch or for a tongue-tied baby. But what I'm constantly telling my patients is they are not one size fits all. This is a Medela cone-shaped shield. This is the size and shape that many people are given in the hospital, but it might not be the right one for you. This is a size 16. This is a really small one. Most of the time people are given either a 20 or a 24, which is significantly bigger than this. I don't usually use the cone-shaped shields. These are two different brand cone-shaped shields. I tend to use more of the cherry-shaped shields. These are by MamaVac, and then I love the ones by Lactation Hub because they do stick on the skin better. So when I'm doing a nipple shield fitting, we have to consider both the size of the baby's mouth and the breast anatomy. So in my practice, this is what most of my nipples look like that I'm seeing on a daily basis. Smaller, shorter nipples. Okay, so when you're using a small cone-shaped shield, and don't just put it on like a Band-Aid, because if you do you see all that space in there, the baby's going to come in and bite and pinch and can still cause pain and damage with the shield. So when you do put a shield on, you want to flip the shield back to make a cup, get that nipple in really deep, and then flip the shield on. Do you see how much more nipple is in that shield? You want the nipple 1/2 to 3/4 of the way into the shield. Now, the biggest problem I see with cone-shaped shields is that if the nipple is elastic, meaning super stretchy nipple tissue, I have seen that nipple pulled right through the tip of the shield. So if you have 4 perfectly spaced little dots, blisters, bruises on the tip of your nipple, and you're using a nipple shield, that is the wrong size and shape shield for you. Ouch. I would not actually put this person as a first choice in the cone-shaped shield, even though this is a better size for this nipple. The nipple fits in nicely. I tend to not like that shape. I do tend to use more of cherry-shaped shields. So this cherry-shaped shield, again, we're going to pull it back into a little cup. We're going to get that nipple in nice and deep and stretch it on. And that is a better fit. This shape will allow that nipple to stretch and fill the shield without being pulled through the tip. Now, this is a MamaVac small, and this would be a really nice size to start this person in if they were breastfeeding their baby. It fits the nipple well. If we hear the nipple is being pulled through, if it's still painful, we could then potentially go up a size. This is the medium MamaVac. And again, I'm going to flip that on. I'm going to get the nipple in nice and deep and stretch it on. You can see that doesn't fill the shield as much, but if this tissue stretches and swells, this has a little extra space. It would be too big if we hear the baby squeaking or clicking or pulling on and off of that shield. So when we're doing a nipple shield fitting, again, it's not one size fits all. This is the Lactation Hub shield, so it's not quite a cherry like the MamaVac, but it's also not tapered. This is a Lancino. Where did my Medela? It's not a taper like the Medela. So this one, I do really like these shields because of the cross between a cherry and a taper. So when we get this nipple in and pull it on, it sticks to that. Do you see how well that sticks to the skin? And it does pull that nipple into a good placement. So if you're using a nipple shield and it still hurts, if your nipple's being pulled through the tip, if you feel like baby is sliding on and off and not maintaining the latch, try a different nipple shield. My preference, the ones that I typically carry with me, are these lovely ones from Lactation Hub that really do stick on the skin nice and have that nice cross between a taper and a cherry shape, and the MamaVac that are in a true cherry shape. If you are using a nipple shield, do make sure that you have an exit plan. You should be using them temporarily. They can increase the risk of dropping milk supply if the baby's not efficiently moving milk through them. They can be really difficult to find in the middle of the night. They can fall off. They can be annoying. If you're using one, why are you using it? And are you given a strategy for weaning? If it's from your nipple anatomy, can you use one the entire time you're breastfeeding? Sure. There's no reason why you can't if the baby can efficiently feed through it. But has the original reason resolved? Is the swelling gone? Is your nipple now over? Is your nipple healed? Have we addressed the tongue tie? Have we addressed other issues? Is your preemie no longer a preemie? Have they now grown? Are they a couple weeks or months old where they could actually latch without that? So they're great tools, but they are not one size fits all. And that's how I approach in my practice fitting your nipple shield. Now you know.